Hey everybody, welcome. Maggie Yu, MD, functional and holistic medicine physician and owner of Transform Autoimmune Disease Naturally. And those of you that are jumping in right now, I'm going to give you guys about 15-30 seconds to jump on into this live. Hop on in. When you guys do hop in, say hi, tell me where you're watching from. That would be really great. Internet is an issue, so there might be some interruptions here and there, but we'll just work with it. Today, what we're going to be talking about, huge topic, which is that there's a lot of press right now. There's some preliminary stuff coming out about the role of hydroxychloroquine, which is Plaquenil. And I asked how many of you want my medical analysis of what's going on with current COVID, what's going on with COVID, and what's up with the drug hydroxychloroquine, which is called Plaquenil. And what does that mean for the public in general, but specifically, what does it mean for people who are immunosuppressed or people who are at higher risk or people with autoimmunity, because it is a drug that we use in autoimmune disease. So for those of you that are jumping in right now, if you could comment in there that where you're watching from, that would be great. Tell me what autoimmune issues you're struggling with. That would be awesome. And if you have questions specifically about hydroxychloroquine and Plaquenil, that would be great. I'm going to try to answer as many as I can. There were a lot of questions I already curated from you guys from the post earlier today, which is great. So I'm going to dive right in and I'm going to answer it. Those of you that are watching in YouTube right now, please make sure you subscribe and click to get notifications on the channel every time I have a new video that shows up. And those of you who are not in the Facebook group, go ahead and click and join Transform Autoimmune Disease Naturally right now to join our Facebook group, where I'm going live every day right now to give my analysis and talk to everybody about everything holistic, alternative that you can do that's data-driven, along with medical analysis of what's going on right now every single day. So those of you that are logging in, great. And anybody who's an alumni, please comment in the comment section that you're an alumni of a program. And anybody currently in the program, say that you're program. That'd be wonderful. What I would like to start out with is what is Plaquenil? What is hydroxychloroquine? It's a 60-year-old malaria drug. And what they found was that this particular drug and many drugs, just as many supplements, can work with many different mechanisms in your body. So what happens is that people have found that people who happen to be on it for malaria prevention or treatment had some improvement in some of their autoimmune arthritic symptoms. And so it's become and it's been used for a while as an autoimmune drug, and actually mostly RA and lupus, and sometimes Lyme arthritis. There are some mechanisms that it makes sense. One of the mechanisms is, and I'm not going to boggle you down with it, but it can actually work with what's called toll-like receptor on your cells, immune cells, and it causes a decrease in a particular pathway that can generate increased inflammation. So this is to point out something, which is that your immune cells, which is your white blood cells, there's many branches, many different ones, and many different mechanisms, and they can work in many ways, not just to, hold on one second, guys, sorry about this. They can work in many ways to not just, improve your immune response, but there are pathways in the immune system that can increase or decrease inflammation. This is why all of you guys with autoimmune disease that I'm talking about, if you're dealing with an autoimmune disease issue, we're talking about immunity, but it's linked with these arthritic inflammatory issues that are going on as well. This is how all these pieces together. I got my cat here again. We have a visitor. This is Jack. Anyway, what I want to talk about is that it is a drug that's used in autoimmunity. And there are a lot of questions right now, which is what is the data about how useful it really is? And what I can tell you is it's very preliminary data, but it's very promising that it is helpful in the treatment of someone who has COVID. But the study's small. We're talking 30 people. That's it, 30 people. And they showed that 50 to 70% of the people taking this who were infected by day 3, clearance of the virus, and by day 7 about 70% of people have clearance of the virus versus the normal group, which was it took 14 days or more to really clear the virus. So it is promising that it can shorten the duration that someone has an infection. And this is important to point out, which is that this is hopeful, right? There is something possibly that can shorten this illness, but the extrapolation of that is where all these other questions come in. And this is why I want to talk about this in an autoimmune population. There are people right now with autoimmune disease who are on Plaquenil or Hydroxychloroquine. Tell me who you are now in the comments. Say that's me. I'm on it, okay? Those of you that are on it, people are asking, should I stay on it? Well, of course, 100% you should stay on it because you're on it for autoimmunity. And if you came down with COVID, it could have a possibility of shortening the duration of it. That's all we have, and that's from observational data, very small study, okay? The question is coming in where a lot of people are saying, should I get on it? And I am going to put some major caution here for everybody here, which is that this medication is not without significant possible side effects, and long-term use of it, there's a lot of issues. Short-term wise, I mean, some of you who've already tried it, I mean, I remember Debbie was just commenting how she got a severe fever with it. And then you're gonna mess that up with thinking you have COVID? Right. The other thing, some people have severe rash with it. Some people can have severe stomach upset. And any time, and those of you who have autoimmunity, know that when you start any medication, what can happen? You can actually have a side effect that can land you in the hospital or the ER or the urgent care or in your doctor's office. That is the last place you wanna be right now. So is this a good time to start a new medication for autoimmunity? My recommendation, hell no, okay? The other aspect of this is that there is also interactions of this medication with many other medications. When you're looking at the interactions of Plaquenil, it can interact with insulin, it can digoxin, any medication that's metabolized by your liver and some with your kidney. There could be some interactions with it. Is this the right time for you to get a liver or kidney interaction with this medication? Right? Just think about it. Think about it. So as far as trying to get to a new start of this medication right now, because you have autoimmune disease, it's probably not a great idea, because any change of medication, addition of a medication or initiation of a medication can cause some side effects that can land you in the hospital. And for some people, it can make their autoimmunity worse. How many of you have been on an autoimmune medication that was supposed to help you only to find it made your symptoms worse? Okay, if that's you, write it in the comments section right now. So I want you guys to be really careful about, first of all, asking to start this medication or to add this medication to your autoimmune regimen. This can land you a hot mess in the middle of some major exposures in the ER or urgent care, or trying to get into your doctor when access is already really poor right now and people who are going to access their doctors are sick. Is this making sense? I hope this is making sense for everybody. For those of you, the other issue that I want to talk about is that a lot of you that are on there's a lot of questions people are asking me about medications on autoimmune. And I want to talk about that. This is a serious issue, which is that there is a lot of medication that are for autoimmune patients that are immunosuppressants, okay? And if you want to just, what I would recommend is people are asking, what is this one it, is that one it? I can tell you right now is that you need to Google your medication and check if it is an immunosuppressant, okay? And if it is, you are at much higher risk of contracting this virus than other people, because your immune system is actually busy trying to, the drugs shut off your immune system. And think about this concept. If your immune system is supposed to fight germs, look at your germs outside and say, you're a germ, I'm going to kill you. In autoimmunity, a lot of our immune system is looking at our own body thinking it's a germ, and it says, you're a germ and I'm going to kill you, right? And so what do? We take a drug that shuts off your immune system. While short-term wise, that can decrease the attack against your body, what else is happening? It then decreases your ability to fight germs. This is a big problem. You that are on immunosuppressants, okay? And then that's why for me, like, it's a really important time to not think about trying to adjust these medications, like add a medicine, remove a medication. Because a couple things is that, yes, while it's a balance, right? It increases your risk of getting the infection, but at the same time, if you stop it, it's gonna precipitate a flare. okay? And then you'll end up in the ER in your doctor's office. Last thing you want to do. So one of the things I really look at this is you got to approach this with confidence, which is what I teach people about in our program. I mean, our program is a 2-month program done completely online. It's always been online. The last, we've been at this for years. And I like the idea that I can have time to actually lead and help people learn what are the things that really you can do to actually calm your immune attack against yourself, so then your immune system can actually work for you to fight germs. So then at that time, you can confidently make decisions about lowering or eliminating of your medications when you're ready. And that's the issue. People don't get ready for it, and they make these rash decisions themselves at more risk. And how do you get autoimmune confidence? You do everything that it takes in our 5 pillars. My protocol has 5 pillars that you absolutely have to master and own. And ask our alumni, how many of them used to get sick all the time? Ask them how frequently, I mean, those of you who are an alumni right now, answer people like, how frequently did you get sick? How frequently do you get sick now? And how much shorter are the illnesses when you do get sick? That's what happens when you actually have your immune system to work for you instead of against you. And once your immune system, you calm your autoimmune attack down, then what happens is you can actually have, work with your doctor to actually start lowering some of these medications and make medication change to set yourself up for success. Now, that being said, all this emphasis on hydroxychloroquine, one of the questions people are asking is, does it prevent me from getting COVID? And the answer is hell no. There's nothing to indicate here that taking in this daily or trying to hoard it right now and try to get on it right now prevents you from getting it. So what's more important right now is that there's data-driven stuff of what can actually, supplements that can help actually prevent, supplements that can treat early symptoms, that has data behind it. If you guys have missed my training, please make sure to go in the group or go to my YouTube channel. I have had multiple trainings that I've done this week, teaching you guys of what's data-driven supplementations that work to actually prevent and treat some early symptoms of any cold or flu right now. And it's just good sense to support your immune system with data-driven supplements and lifestyle and nutritional changes. I did a nutrition video. I've also curated a specific collection of antiviral products, and I will have Elsa list the link here below. It's also in the announcement. These are products that are tried and true, that I have recommended to my autoimmune clients and patients for the last 23 years of my career, and they're data driven. So I put it all into one place. We have an antiviral bundle. Go and take a look and build your own bundle, and you can that they're data driven, and number 2, they've been used in my population of autoimmunity for a hell of a long time. Components of these have all been used and recommended by me with great success. Okay, so I want you to take a look at supplements that work. Later on I could do a training if we want to specifically talk about supplements for prevention. Now, that being said, what I want to talk about is right now, timing is crucial. Okay, a lot of you are dealing with fears. You're getting your self-care. What are some of the things that you can do right now? One of the things is that social distancing. Please make sure not just you, but man, your kids, your teenagers, your young adults in your home are social distancing to keep you safe. That's really important. Number 2, avoid going to the doctor's office, ER, urgent care at all costs right now, because that's where all the people with exposures are. Number 3, work on your nutrition. I did a whole nutrition training. Go ahead and watch that. Number 4, work on your mindset, your thought patterns. And I did a whole video training earlier in the week on mindset. Okay, I'm sorry it keeps freezing, but the internet keeps going in and out. Now, one thing that I want to talk about is, why is timing right now key? Timing right now is really important. Am I still frozen, or are you guys getting me right now? Timing is really important. Why is the time right now the most important time for you to actually focus on your autoimmune? Because here's the deal. If you're going to flare right now, you're going to end up in the ER. So your most important thing, the biggest threat to your health and your family's health is not COVID, it's your autoimmune disease unchecked. Okay, so this is the best time to turn it around right now, and which is why for me, we're home, okay? We are home right now. You are home, and our program has been virtual and online this whole time. If you're ready, just over the next couple weeks, to turn around your immunity, to get your immune system to work for you instead of against you, book a now. We are getting inundated with requests of people who are saying, I'm ready now. People even we've talked to 3 to 6 months ago, now they're ready. And so I'm putting some time, we're added some extra appointment slots. And you can go ahead and click the link right now and book a call with us to talk about if it's the right time for you now to actually work on your autoimmunity, calm it down so you don't flare. And results can happen within weeks, and it can be done entirely online in the safety of your own home. Okay? So that I have about hydroxychloroquine. I'm looking at some of these questions right now. If I'm not frozen, let me go through any questions that you have. Yeah, some people are saying, yeah, medications has caused me some major side effects. And you don't want to be a test bunny right now, a lab rat right now for testing a new medication on you. I'm getting nervous. I'm not feeling too well. Mindset, guys, really think about mindset. Let's see. Is this helpful, everybody? Okay. I was going to talk about, what are the long-term side effects of being on Plaquenil? I forgot. This is really important. Long-term side effects of Plaquenil is, believe it or not, retinopathy, retinal toxicity. That means you can actually go blind. Your retina can go blind if you take Plaquenil for a long time, and the risk of that goes up the older you are. So people over 60, very high risk of retinal toxicity. Also depending on how long that you take it. So there's some long-term side effects with retinal toxicity to your eye and your vision from taking Plaquenil. There's also issues they've identified with liver issues, like with causing liver toxicity or kidney toxicity. So this is not necessarily a good long-term solution. Short-term right now to deal with somebody who has a infection, I think it actually is looking really promising, and I'm glad it's getting pushed through to have more people try this medication when they're actually infected. But focus, guys. Right now, the key is you guys need to focus on prevention. So prevention is key. And then number 2 is focus on your autoimmunity right now to calm your autoimmunity. That is the best life-saving thing to do right now. Okay? I hope that was helpful, everybody, and have a great night. I will be live tomorrow night as well. I know it's Friday, Saturday, but I will come on live tomorrow night as well. I'm sorry the internet keeps going in and out, but right now that's just how the internet is with everybody on it. So I hope you guys enjoyed it. Have a great night, everybody.
Lupus, lung fibrosis,
Hashimoto's thyroiditis,
fibromyalgia, AS, which is a form of arthritis.
that's too far, extremely fatigued.
Pretty much zero joint pain.
Much more happy.
I don't have brain fog anymore. How much weight I have lost.
I want to see remission.
Maggie and her approach is very different than the traditional doctor.
I'm a totally different person.
I got a better understanding of what those intolerances were.
You're not alone.
The community is, I'm learning from everyone else's issues.
It's not just helped me, it's helped my entire family.
We are transformed.
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 Join the movement and transform your autoimmune naturally today.